Since day one of the pandemic, healthcare workers have been risking their lives to protect ours. At 9, we showed you our exclusive look inside a COVID wing right here at Methodist. As COVID-19 cases continue to rise in Shelby County, some healthcare workers say they are emotionally and mentally beaten.
I mean, can you imagine? This has been going on for months. Fox 13's Kirsten Garris is live outside of Regional 1 right now. Kirsten, you got to sit down with these nurses and doctors. How are they holding up? I mean, we're talking about 9 months in the trenches on the front lines of this pandemic.
Well, I mean, it hasn't been easy. Early on, many of us remember all the free meals and that constant support for our healthcare workers. Well, all that has really died down. But now the fight is even harder than ever before as hospitals inch closer to capacity. And healthcare workers, they're dealing with not just a few, but hundreds of deaths because of this virus. It started out as an unknown virus.
And should we prone them? What breathing treatments are the best to use? Nobody knew.
A virus that didn't see race, gender, or status.
Protect yourself because you don't know what you're going to be taking home to your family.
A virus that's still raging 9 months later.
We're being, stretched beyond what we thought our limits were.
These are the faces of healthcare workers at hospitals in our community, fighting on the front line against the coronavirus.
Everyone who was in our COVID unit came together as volunteers. There wasn't anyone in our unit initially who was assigned there. Everyone raised their hand and said they wanted to go work in there.
Regional 1 nurse manager Scott Anders says in the beginning they didn't have any COVID patients, so they studied and prepared for a virus they didn't know much about, but knew would be in their hospital soon.
You had to train nurses to be nurses again and doctors to be doctors again. Everything you did, you were thinking it through. You had to go step by step. What is the best thing to do?
Anders says the floor started filling up by spring when restrictions were still being developed.
Having to make that decision, can we let a family member up here to look through the glass, to be as close as they could. But, we made that happen for that family, but at the time, we weren't sure if that was the right thing to do, but it's what was right for that patient and that family.
But now those calls are even harder to make as dying patients are isolated from their loved ones.
We brought in iPads, all different kinds of things, trying to connect you to the outside world along the way. I've been at bedside for a few of those moments, and I wouldn't wish that upon anyone, to have to be so alone.
Across town at Baptist Memorial Women's Hospital, labor and delivery nurse Lauren Faulkner says none of her patients have died, but some have been critical. And what has that been like to have this, seeing the virus take its toll on that?
Scary, because it takes that one patient for you to be like, this could be you. This could be your friend. This could be your family member.
She says early CDC guidance recommended separating newborns from COVID-positive moms.
They understood for the most part, and I think it was because they wanted what was best for their baby.
She says CDC guidance now allows COVID-positive mothers to be with their baby, one weight lifted off their shoulders as another one presses down on them.
It's like it's never going to end, and at this point, I don't know how we're even going to get it to end because people don't listen. But at the same time, people have to work. People have to keep going with their lives. They have to keep making a living to support their families. So I understand that too. But we also have to contain this virus.
Dr. Jennifer Snow is the medical director at Baptist Memorial Hospital's pediatric ICU. I first talked with Snow in April when she would sleep at the hospital during her on-call shifts, a decision she made to be with her patients and to keep her own family safe from COVID-19. It's a sacrifice she still makes today.
My kids, on a routine basis, kind of ask me when I walk in the door, is it safe to hug you, Mom? Which, as a mom is kind of heartbreaking and difficult to hear.
Dr. Snow says her 8 and 9-year-old understands she has a job to do, but she says there are moments when she underestimates the impact of the pandemic on them.
My son, one night I was putting him to bed, and out of the blue he asked me, and this is very hard to say, but he asked me, what would happen to his sister and him if you or dad died of COVID? And that hit me very hard, but it made me realize that kids and my own kids are internalizing what they're hearing and what they're seeing.
Snow says the pediatric unit is treating more young adults with COVID-19 to help lighten the load for the main hospital. But she says the virus is taking a serious toll on her teammates.
Everyone is still doing their best, but after months and months, what's the toll going to be on the healthcare workforce? And we're already seeing that with mental exhaustion, burnout, trauma, seeing everything that we and especially my adult colleagues are seeing is traumatic. And how is that going to impact us as physicians, as caregivers?
Despite the long hours, the tough calls, and the difficult moments, these healthcare workers say they still have hope.
We're always helping each other. And even when it's rough, we know we're going to get through it. Just take it one patient at a time.
And these healthcare workers say the new COVID-19 vaccine is welcome news, and they feel like it is the light at the end of the tunnel, but it isn't a silver bullet. These workers say if you really want to thank them, they're urging people to do what works right now. That's washing your hands, wearing a mask, and staying socially distanced. Live outside of Regional 1 tonight, Kirsten Garris, Fox 13 News.
Kirsten, first of all, that was thank them for allowing us to hear their story and go inside the
Absolutely.
world that they face. And did they talk at all about the early days? Remember, DG, they didn't even have proper PPEs. And now you tell us, Kirsten, they volunteered to go early on.
Yeah, that's right, Merle. I mean, almost everyone said they just, like Scott Amners, who's actually a nurse manager here, he said he just knew he had to start. And what's interesting, we couldn't fit this into the story, he actually has a counter on his phone counting every day since they opened the COVID-19 wing, and I think we're now at 270 days by his count. 270 days that many people have shown up to work not knowing what they would encounter, not knowing what could happen next, knowing they had to for our community. So that just speaks to the volume of dedication from our healthcare workers.
Merle and Kirsten, too, this is the only thing I can relate it to. I've never been in the medical profession. I know plenty of people who are, but I remember asking my father when I was very young. My father was a Marine. It's like, Dad, why would you choose to be a Marine? Why would you choose to, possibly have to go to war? And he told me, he said, son, I don't know, but it takes a very special person to run toward the sound of the battle.
Yeah,
and you know what?
That's
exactly what these doctors, these nurses, these nurse practitioners, all the way down to some of our primary care physicians, our specialists, that's what they do. They run toward the battle. And we have to thank them for that. We have to understand what they're doing and appreciate what they're doing.
Brilliant story. Thank you very much, Kirsten.